This was the underpinnings of the PANTHER study. This was an NIH-sponsored study done by a network of clinical sites throughout the United States, which attempted to answer two questions at the same time. The first question was, what is the role of N-acetylcysteine? And the second question was, what is the role of prednisone and azathioprine? So there were three arms to the study. The first arm included triple therapy with prednisone, azathioprine, and N-acetylcysteine. The second arm included N-acetylcysteine alone. And the third arm was placebo. The study was followed closely by the Data Safety Monitoring Committee, who at one point noted that one group was doing particularly worse. That group happened to be the group who was getting triple therapy with prednisone, azathioprine, and N-acetylcysteine. So the study was halted and a paper was published fairly expeditiously to warn people about the deleterious effects of combination therapy with prednisone, azathioprine, and N-acetylcysteine. So prednisone and azathioprine are now contraindicated in patients who have IPF, whereas these medications might and still are used in other forms of interstitial lung disease, hence the importance and the critical aspect of making an accurate diagnosis of IPF versus other forms of interstitial lung disease. Getting back to the PANTHER study, this was continued as a two-arm study comparing N-acetylcysteine to placebo, and this turned out to be negative. It wasn't harmful, but it appeared that N-acetylcysteine or NAC in isolation was not a useful therapy in terms of delaying loss of lung function in patients with IPF over the course of this particular study.